Welcome to Nirmalam.org. In continuation of discussion on the lifestyle disorders, in this episode, let us understand about hypertension. Our body has about 5 liters of blood circulating to every part of the body to transport nourishment, regulate temperature, and many other functions. This is possible with the help of the heart, acts like a pump in helping circulation of the blood. The blood passes through three kinds of tubes, viz. Artery, capillary and vein. Artery carries oxygenated blood from the heart to the system. Capillaries create a network of thin tubules less than the size of a hair to supply the blood to the organs. Capillaries also collect the used blood and send to the veins. Veins carry oxygenated blood back to the heart. Hypertension is a medical condition characterized by high pressure of the blood in the arteries, the vessels which carry the blood from the heart to the rest of the body. Symptoms vary from person to person, while generally it includes unexplained fatigue or tiredness and headache. This blood pressure, when measured, if it is higher than 180 by 120 millimeter mercury, is considered hypertensive emergency or crisis. Untreated hypertension can cause heart disease and related complications such as heart attack, stroke, and heart failure. It's important to have your blood pressure checked at least every 2 years starting at the age of 18. Simple lifestyle changes can regulate high blood pressure, but when blood pressure is very high or lifestyle measures fail, medications for lifelong will be recommended. Some of the complications of hypertension include heart attack, stroke, heart failure, aneurysm, kidney damage, loss of vision, metabolic syndromes, memory problems. If you look at the risk factors, some of them are age, family history, being overweight or obese, lack of physical activity, tobacco use, too much of salt in your diet, too little potassium or too little vitamin D in your diet, drinking too much alcohol, and uncontrolled stress. Some of the medications recommended, although you need to consult a doctor, are diuretics, beta blockers, ACE inhibitors, angiotensin receptor blockers, calcium channel blockers, alpha blockers. But do not take any medication yourself. Do consult a physician for their recommendations. Here are some of the lifestyle changes that can regulate hypertension. Maintain a healthy weight, eat a healthier diet, quit smoking if you are, limiting or avoiding alcohol, get regular exercise, reduce salt intake, learn to manage tension or stress, take a well balanced diet rich in calcium, potassium, and magnesium, and most importantly, reduce the stress. In summary, hypertension is a condition in which blood pressure is higher than normal for a considerable period, which leads to multiple health complications. There are medical interventions available to treat the condition. More to it, modifying the lifestyle help manage the condition better. In our next episode, let us discuss about another lifestyle disorder.